Well, let's dive in, folks. I'm Congressman Huffman over here on your screen. I really want to thank you all for coming together on short notice. And, the reason that we're doing this is we're really trying to tell the story to this administration and to my colleagues in Congress, if we can get them to listen, that some of these extreme early actions that are being taken are really disruptive and hurtful, especially in rural communities like the ones I represent in the North Coast of California. So you are important messengers and points of trusted information. And I thank you so much for helping us to do that in a way that hopefully protects your interests. Okay, so we are joined by some friends from the media that I have invited because it's hard to tell the story if no one is listening, and we are hoping that they can help provide a megaphone and amplify the alarm that I'm hearing all over my district right now about what some of these things mean. And of course, it's been really dizzying. I mean, just on the first day, on Inauguration Day, we saw 26 executive orders. We have seen 40 more signed since then. We have never seen anything like it, and we are still scrambling to understand the scope and the legality and the implications of all of these different orders. So um, here's what we do understand. The Office of Management and Budget kind of got everyone's attention on Sunday when they put out this sweeping memo that purported to freeze everything, all federal grants and contracting and any programming involving federal funding except for Social Security and Medicare, so that senior political appointees in the Trump administration could go through and do a political review, essentially, to make sure that everything comported with all of these dozens of new executive orders. And that includes everything from orders saying stop all funding under the bipartisan infrastructure law, stop all funding under the Inflation Reduction Act, stop all funding that looks like the Green New Deal, whatever that is, stop all funding that involves wokeness or diversity, equity, and inclusion. I'm still trying to understand where things like equity and inclusion became dirty words, but what we are left with right now are executive orders that say you can't do that anymore with federal dollars. And this OMB memo was moving out very quickly to enforce that. Now, thankfully, we got some help from a court that held that up. And then the Trump administration put out a clarifying memo saying we're going to withdraw the OMB memo, but we're still moving ahead with a funding freeze. And I'm grateful that a federal court enjoined that temporarily as well. So as we sit here today, my understanding is we don't have an actual across the board federal funding freeze, but we do have an administration that is saying they are still intending to go very aggressively down this road. And bear in mind that that road included 3,200 line items in a spreadsheet that OMB had sent out to every federal agency that instructed them for each of those line items to identify a senior political operative in the Trump administration to do this litmus test and find out if everything was kosher with the executive orders. So, look, we are not out of the woods. At best, we are in a moment of temporary reprieve, and I think it's an important time for us to take stock and try to understand what this means. That's why I'm trying to have meetings with individuals and constituent groups, hear directly from them. A couple days ago, I met with tribal leaders, and I represent more tribes than anyone else in the lower 48 states in Congress. And the stories we heard there about the amount of programming that could be interrupted or stopped and what that would do to their communities. I mean, the Indian health centers are right in the middle of the crosshairs for many of these orders. So much of what they do involves equity and is done in the name of environmental justice, another thing that the new administration is trying to freeze and shut down. And they have helped me to understand the implications of that. So many of these Indian health centers are the only game in town for remote rural communities. They serve more than just tribal members, they serve the whole community. They include counseling programs and suicide prevention programs for LGBTQ youth. the most vulnerable population in America, tribal LGBTQ teens, highest suicide rate in America. And we have programs with federal funding that are making a difference in saving lives. All of that goes away if this funding freeze rolls out as it has been represented. And there's just many, many more examples. But I wanted to pull all of you together because each of you represents an important perspective and an important constituency that I think has reason for concern. Right now, we're talking a lot about what could happen, but I'm also starting to hear from what's already happening. We just got word in the last 24 hours that one of our nonprofits in the southern end of my district had a grant pulled because it involves climate change education. Huge and abrupt disruption to that nonprofit's whole operation. And we're going to hear, I think, a lot more about that. We've got restoration and wildlife protection work, resiliency programs that are important to fire safety, things that are, we're counting on in these communities to move forward. We've got a freeze on anything, as I mentioned, coming from these two really important laws, the Bipartisan Infrastructure Act and the Inflation Reduction Act. A lot of that involves hard infrastructure that our communities need for transportation and broadband and any number of other things. And so you just can't overstate the impact and the disruption if this continues to move forward the way it's been rolled out. And with that, I want to hand it over to you and see if you can provide us some examples on the ground from your perspective of what you're worried about, what the implications could be if these political filters get triggered and your funding gets interrupted, and what that means for people's lives. By sharing that with us, you will help us tell the story. And I'm going to take these stories straight back to Washington. I hope our friends in the media will help us tell these stories too. But I'm really grateful to have all of you with me. And we thought we would start in the field of education. Rural education is always tenuous. And obviously, there are a whole bunch of ways in which the executive orders and the other guidance we've gotten, could involve Title 1, 2, 3, 4, IDEA funding, rural and low incident and E-rate program, school nutrition, transitional partnership program. I mean, we've got a long list, and I know you education leaders will know it better than me. So if we could start, I want to welcome Michael Davies Hughes, who's the superintendent of the Humboldt County Office of Education, to get us started, and then we'll move through some others.
I appreciate it, Congressman Huffman, and good afternoon, everyone. Yes, you have just listed off a number of programs that would impact our county and our county's students negatively if we had this funding freeze or cuts or delays in funding. And unfortunately, as is often the case, this negative effect would be disproportionately felt by students who are already at a disadvantage. So we're talking about our students in Humboldt County that are living in poverty. And if there are impacts to Title I, that would have a devastating effect on our most vulnerable students in the county. When we look at, some of the issues around secure and rural schools funding, which we know has not yet been reauthorized, but some of our districts, that is the bread and butter of some of the operating for some of our smaller rural districts. Now, remember that in Humboldt County, we have 31 school districts, 15 charter schools, and they're all small as compared to the rest of the state of California. So we have school districts of less than 15 students. We have several schools that have less than 15 students. So any impact of any dollars that they're expecting is going to have a significant impact on their operation. So I know that some of my colleagues here from Humboldt County and across our region will have some other things to chime in on, but I appreciate the opportunity to be able to be in this venue. Thank you, Congressman Huffman.
Thank you, Michael. We also have Jeff Harris from Del Norte County Unified School District. Jeff, welcome. I'd love to hear, some of the things you're worried about here.
Thank you, Congressman. So I will reiterate what Michael said. The disproportionality, I think, of the impact when we start looking at students that are socioeconomically disadvantaged, students who come from these more isolated rural areas in Northern California, the lack of supports just generally. So as we talk about Title I, Title II, Title III, Title IV, and Title VI, we're also now starting to talk about impacts on homeless and foster youth and on Native American youth, right? So as we continue to go through just kind of looking at how these impacts roll and we talk about kids, I think the other thing we need to talk about is how these dollars also go to support the staff who provide services for these students. I'm sure you may be aware of our story. Last year, we had over 200 job openings that we were unable to fill in our county. This year, that's down into, I'm going to say, the mid double digits at about 50 to 60, where we are utilizing a lot of those funds, however, is in professional development because we have a large number of staff that have joined us, certificated staff on PIP, STIPs, and interns. And so they need that additional support that we're utilizing Title I, Title II to be able to fill. There are also three other big pots of money that I don't think folks sometimes think about. One of those is demonstration grants. So we have a mental health demonstration grant that funds for PPS, people services credential folks that are providing counseling, along with 8 to 10 psychologists or social workers that are being trained to take those jobs in the future. A big impact in our small rural area, along with the Del Norte Indian Career Pathways Grant, which provides college and career support and guidance for over 800 students that are here locally. And then we roll into, and I know it's connected to schools, but it's not school, the Klamath Promise Neighborhoods Grant, which was a $30 million grant to provide economic resiliency, healthcare, a variety of community supports in the Klamath area and also Del Norte as a whole. $6 million of that over 5 years has gone to support the work that we're doing with students in schools. Every dollar that goes away because of a lack of federal funding is a dollar that comes out locally, and we just can't sustain that.
And so much of that funding was explicitly to address equity, right?
Absolutely.
I mean, so it would seem to be directly in the crosshairs of, what has now become a dirty word, diversity, inclusion, and equity have to shut down.
We would anticipate the vast majority of each of those grants, if they were stopped immediately, would go away.
Yeah. Thank you for sharing that, Jeff. We also have Fabio Robles from the Trinity County Office of Education and also Jamie Green from Trinity Alps School District. Welcome to both of you. Would love to hear the view from your districts.
Well, thanks, Congressman, for having us. Appreciate you taking on the mantle to advocate on behalf of rural and frontier areas such as ours. As you're aware, Trinity County is primarily forest lands, federal forest lands. So, while we make the most of the funding we do get, we're also the 58th out of 58 forest county in the state of California. So we depend heavily on federal funds. Right now, as a county, outside of the Forest Reserve, which you're very much aware of, that's $1.57 million to Trinity County schools. And then another $1.5 million in the other federal programs that have been talked about. So, that's about close to, for some districts, half of their budgets. For some districts. And I'm just kind of generalizing here as a whole county. I would say if you take that, it'd be about 20% of, if not more, of our budgets for the entire county school system. So one of the things that hasn't been addressed here is we just recently received a grant of about $1.5 million through the California Youth Health Behavior Initiative, $1.5 million. My understanding is that grant was actually funded by the federal government. Not 100% certain on that, but that was a grant that's helping us do wraparound services here in Trinity County, and that's for early childhood, getting into the homes, dealing with early childhood early on, so that we can prevent them from, maybe as when they start school, have a head start getting it as they go into school. So that's one of the programs that is also helping us build capacity to do Medi-Cal billing for some of our mental health services. So one of the concerns is with Medicaid is, while I understand it's a $2.3 trillion budget, one size fits all is going to be pretty damaging to the kids we serve in our county. For instance, if you have a kid with cerebral palsy, and they've been, dealt that hand in life, this program, will cover them for their entire life. And I get it. It's not the same for someone who has maybe ADHD and getting the same benefits for life, but maybe there's a way to come to a common ground to make sure we take care of kids that have cerebral palsy or severe disabilities, so that they're taken care of their entire life. And we have several of those students in Trinity County, and I know that hasn't been talked about yet, but that is a concern of ours, is the Medicaid potential cuts.
Yeah.
And sir, we have 3 specific examples. You're fully aware that the Senate voted 100% to hotline secure rural schools, and then the speaker never put it up for vote. So that will literally take the wheels off our buses in our district, because we lose. Fabio does a wonderful job representing our whole county, but I just want to give you a one district perspective. So we will lose $600,000 and have 5 to 6 layoffs that we'll have to do in March. It's 23% of our county road department budget, just secure rural schools. So they're concerned about that. Number 2 is we got a mental health grant that we wrote for Siskiyou, Modoc, and Trinity counties. And we recently, I'm going to be honest, I'm not going to apologize, we moved all the money out of the account because we had word from some friends in DC that this might be happening. And then we got a letter back saying, put all the money back in the account. Well, sir, to be honest, I'm going to keep enough money that we can guarantee that we're going to put out 26 counselors, social workers, and psychologists of people that currently work in Siskiyou County, Modoc County, and Trinity County. We're going to really take care of our mental health. If that grant gets cut, that's going to put us right back to everything being telehealth. And then the last one is, I've been working across the nation with you. There's a crisis in special education. So the federal dollars that we're getting in IDA, sir, you have the most important bill, foreign policy, anything else. I talked to my good friend in Texas, and they have a huge problem with having enough staffing for the amount of disabled students we have. It's went up exponentially. 3 days ago, we had an autistic child in TK get lost because we didn't have the funding for a one-on-one aid, and we were trying to do 1-on-3. That was my granddaughter. It was pretty hard to go to my wife and my daughter and say, and it can't be about money, sir, but we have to get your bill through.
Yeah.
But this started in the 118th Congress. When the Speaker of the House did not take a bill that had 100% from the Senate, I knew something was up, and that was the first domino. So if you could please champion secure rural schools, IDA, and the mental health, it'd mean the world to our kids. It really will.
Thanks for sharing that, Jamie. And you're right. You folks are so much more vulnerable to disruption of those funding streams than, a lot of more urban districts. It's just life or death, I think, for a lot of the communities you serve. So thanks for sharing that. I want to move to early childhood education, childcare and nutrition, definitely in the crosshairs of a lot of what has come at us here. And we're joined by Mary Ann Hansen, who's Executive Director of First 5 Humboldt. And Mary Ann, I take a look at the Title IV-E prevention programs as one pretty clear example of something that could just go away if this rolls out as it looks like it might. I want to hear your thoughts.
Thank you so much for hosting this conversation. I really appreciate it. First 5 Humboldt's Welcome Baby Pathways to Resilience program would be impacted. The Humboldt County has the highest infant mortality rate in California, according to the Strong Start Index. The rate is especially high among Indigenous babies. Our program is designed to address that disparity and increase infant health by providing home visits to newborns with parent education and crisis supports. And then the Pathways to Resilience part of the program continues those visits to babies whose parents have a history of substance use disorder, helping them get treatment, parent education, and resources. If that program were frozen, several local clinics would be impacted, including United Indian Health Services, Kamau Medical Center, Redwoods Rural Health, the clinics that are serving the most rural communities in our area and whose clients experience the greatest health disparities. Families would lose access to those supports during the most vulnerable time of their babies' lives, and funding for local jobs at those clinics would be lost. And it just feels like a real crisis, and it's just terrifying to me that funding might be frozen.
So Marianne, do I hear you right that you've already got the highest childhood mortality rate in California, and
Mhm.
these are your most essential tools for making it better?
Absolutely. Supporting those parents, education, helping them get to their appointments, get to their treatment, all of those things would be lost if that funding was frozen.
Yeah, thanks for sharing that. So Carrie Venegas is Executive Director of Changing Tides, serving Humboldt, Del Norte, and Trinity. Carrie, tell us your perspective here, please.
Thank you, and thank you for hosting this meeting. One quick clarification, we actually serve all of Humboldt, and we have sister agencies in Trinity and Del Norte.
Okay, thank
So
you.
I just want to recognize that we work closely together as partners. The impact, we have 18 unique programs that go through our agency with disability services, childcare services, and mental health to families and children and youth. And the impact is huge. I have done an entire spreadsheet. The majority of funding is passed through to the state and then commingled with state funds, but the drawdown process would give at best 2 to 3 months maximum, depending on the state itself. But the impact of something as simple as like the child care voucher program, the parent choice program that provides the majority of support for families in our areas to access childcare so they can go to work and school and children can have a safe and nutritious place to stay, would be huge. In our county alone, that's over 1,500 kids, almost 1,000 families immediately would have a cessation. That includes some of our tribal TANF folks through the Stage 1 program, which again, federal funding pass-through. It includes other programs, even Foster Bridge, which is a unique program that the state actually funds now entirely through the general fund. However, if the state has to move funds to allocate somewhere else, that program ceases immediately. And that's a program that enables foster parents to take children because they can access childcare right away.
Okay.
We're talking about some of our most vulnerable kids. Just in Humboldt County alone, there was over $8.3 million that went out in childcare. So now we're also talking about childcare businesses. We're talking about a large number of small business owners. We're talking about women operated and owned businesses. We're talking about a majority of professional childcare providers within centers and center base. Our Head Start programs are definitely in the crosshairs despite what's being said, because they absolutely have equity language in them. And the way that we are required to serve and the way that we value serving families is that all families are served and all families are given access. So that is going to be an absolute huge impact. And a quick shout out, Rep, if I may, is that the child care and adult food program not only is akin to what goes through the public schools, this actually helps child care providers pay for nutritious meals and get reimbursed a portion of that cost. Our state program that the state administers is now 100% federal funding. It's USDA, and once USDA shuts off or freezes those funds, that immediately ceases. And because most of these programs are done in arrears, meaning that they are reimbursed for rather than apportionment up front, means that there's a lot of impact. Our providers are asking if they are going to be providing things for free because they won't know until we know, and we won't know until the state knows. So that's a huge risk right now for anyone in this business. My organization employs over 200 people just in the county of Humboldt. So those are also jobs that can be immediately impacted and furloughed by these funds.
Yeah, thank you for sharing that. And so obviously there's the equity trigger that is all over the work you do. And I am assuming that you don't ask for immigration status for the families that you serve as well. And so you've got all of these executive orders that you could be running afoul of these days where we're supposed to be rounding up and massively deporting anyone who doesn't have the right paperwork. So am I right that those are serious reasons for concern that your programming could just shut down?
Correct. Yep. If you can't demonstrate, and we do not, childcare programs do not require immigration information. We do, however, require copies of birth certificates, which becomes a risk to families, an unintentional risk, but a risk nonetheless. And a majority of the providers in certain areas of our community are from the Latinx community. And also, as you noted, we have lots of tribal families as well who could be exceptionally vulnerable to this.
All right, thank you so much. Moving to the subject of seniors and aging services, Maggie Kraft is with us from the Area 1 Agency on Aging, serving Humboldt and Del Norte. Maggie, tell us how this could affect your work.
Thank you. Thank you, Representative Huffman, for this chance to talk. And many of the things people have touched on, the ruralness, the lack of resources in this area, this is probably all of us should echo that and can echo that. So I won't belabor that. But I will note that close to 25% of the population in our area is either over 60 years of age or disabled. That's much higher than the state average. That happens in rural areas. And there are few resources. I know we'll touch on healthcare in a bit. Our work at our agency is primarily focused on helping people live independently, keeping them in their homes, making sure they're eating, making sure they have legal support, making sure the homes are safe, that they're social, trying to keep people living independently. So when those resources go away and those services go away, more of these folks will either be left on their own, isolated with poor outcomes, and, very frankly, at risk of early death or premature death, living in their homes. We saw this in Los Angeles in emergencies. At the people who are hit the hardest, who die, are people with disabilities and older adults, because they just can't fend for themselves sometimes, and they can't get the resources they need. So we are worried about that. We are a disaster-prone area, and we worry about accessibility and all the things that we're trying to do to help make things happen. Those things would go away. We only have 25 staff. We're small, 20 full-time equivalents. 23 of our employees are women, and more than half of them are over 60 years of age. We're working because we need to, not because, well, today I want to, but we're working because we need to. Many of these people have, they have to work. They're widowed, divorced, don't have spouses. So we worry about those employees being hit with what could happen. We also worry about the newly growing population of homeless elders, which I think we've all heard that, that's the biggest population of newly first-time homeless people are primarily women over the age of 60. We don't have the housing here. We don't have those things. We help people with nutrition, as I said, legal services, family caregiver services, advocacy for people in nursing homes, Medicare help. Maybe that won't be needed anymore. Maybe we won't have Medicare. Housing, fall prevention, health promotion, transportation and medical appointments, CalFresh. Anything we lose is going to put more pressure on families to be taking care of their elders. Many of these elders don't have families. And so as we see the funding we will lose ourselves, since we are small, is relatively small, but we do a lot with that little bit of money. We give money to nutrition programs in Del Norte and Humboldt. We give money to legal services. We give money to Family Resource Center to support caregivers who are often forgotten in terms of, and provide most of the care to people. So we probably, if this is resolved badly, then we'll all be gone. If this is resolved after April, we just won't be here. if that makes any sense, because we don't have the money to go past April. And in terms of, and the question we also have is, we have a lot of state matching funds that match the federal dollars. I know our state is not going to look at this as an opportunity to not provide that money for these services. But then again, with the state's budget being impacted, who knows?
Right.
So while 43% of our funding is federal dollars, all of those federal dollars are on the list.
That's a great point, that the premise of a lot of your state funding is to match federal dollars, and if they go away, there's a question.
Yeah. So that's 48 of our 48% of our funding is the state. And not all of that matches, but what are the requirements? Also, what are the requirements now with these rulings about us using our state money for DEI? Is it all tainted by that grant? I would say they probably say yes. So those are the factors that we're also thinking about here. And I'll wind up. Thank you for the time.
Maggie, am I right that all of these vulnerable seniors that are served by you and your partners this is need-based stuff, right? I mean, these are not wealthy folks. These are folks that are at the very low end of the economic scale.
Right. Well, the Older Americans Act does not allow us to means test. If you're 60 plus, you're available for most of these services, some at 50. But yes, that tends to be true, except for our Medicare counseling. That is probably more broadly serving people. But generally speaking, yes, most of the people we serve come to us because there's no other resource for them.
Well, so many of the programs and services that you all have been describing are need-based and addressed to folks at the low end of the scale. And as I was reeling off all of the different executive orders and the different ways that things might get triggered, I forgot to mention that they've got one on anything that could be deemed Marxist. So, if we are trying to redistribute resources to help people at the lower end economically, it's not hard to imagine, some political appointee from Doge or somewhere else saying that feels kind of Marxist, kind of socialist.
They found out. They finally caught me.
Yeah. All right. Well, listen, thank you very much. And let's go to the area of health. We've been talking a lot about health, but let's go specifically to Tori Starr at the Open Door Clinics that obviously serve Humboldt and Del Norte in such a critical way. Tori, what are your concerns and how would it impact people?
Yeah, and I would like to echo, Congressman, the appreciation we have for you actually holding this and bringing people together, because making sure our voices are heard is incredibly important at this time. So I'm struck by the lack of process mostly. And the disruption just that lack of process has to make these kind of sweeping statements and cutting off of funding is, even when they don't do it, it's incredibly disruptive for that standpoint. We employ over 800 people, serve 60,000 plus, folks as patients. And the economic impact of cutting off our funding would ripple through the economy. And I encourage you to be working with your fellow congressmen from red states, because most community health centers in red states are the primary care backbone, just like they are in our rural counties. So when we get impacted, it impacts everybody's care delivery, because we're only 52% Medi-Cal, right? We serve 25% commercial patients and 20% Medicare patients. So when they start disrupting one flow of funds, it ripples through our ability to serve everybody, because we don't differentiate in our care practices. So if we have to reduce staff, it's going to impact everybody across the spectrum. It's not just going to impact the Medicaid or Medi-Cal population. And they also probably don't think about the fact it's not just medical care, but behavioral health care, as others have mentioned, which is an incredible part of the health of the community. And we know that people with chronic illnesses certainly benefit from behavioral health to keep themselves healthy. We also do dental. And then, like I said, our senior population, just as Maggie mentioned, that's the most growing part of our community, is the senior population. we're moving from being moms and babies, right? But also moving into having more senior population just by the demographics. We're also the largest provider of OB care in Humboldt. So any disruption in any of our funding streams impacts across all our services. So I think that's one of the biggest concerns that we have. We're relatively good from our financial standpoint, but as Maggie said, if it went out 90 days, we would be in significant challenges from a cash flow standpoint. And then I'm concerned about, they've also started to, so even though they pulled back on the freeze, they've now given guidance. I forwarded it to John, direction from HRSA about, no, we're not freezing your funds, but we're going to go in and look at your services. And if you are, you know, doing things around gender affirming care, or if you're doing things around DEI, we're going to pull your funding. So it's not freezing it. It's like, if you don't pass the litmus test, and we've just spent a lot of time and effort. I'm amazed when we see the data around health equity. We know that there are certain populations and people, people of color and the disadvantaged who have poorer health outcomes. And so this assault is very disturbing on the people that we serve from the standpoint, they're the ones who need the help the most. And to be targeting the programs that program for disadvantage is really disheartening, to say the least, from that standpoint. So I'm concerned about further limitations and then just the downhill effect, right? Because as you know, we've had a shortage of primary care across our country. This type of shenanigans is not going to help us recruit nor retain. So I already have providers wondering about, should I stay, you know, in doing this work, because look at how the government's trying to support us, or the folks that are committed to gender affirming care, like, do I want to stay in a place like this? So they haven't really thought at all about just the downstream effects that may occur as you start to go after the funding streams.
Yeah, as I read these orders, I don't think your staff could even talk to someone about something like gender affirming care or counsel them even. It's just unspeakable under these executive orders that say that all gender ideology is henceforth banned.
Yeah, I think the DEI stuff is even more corrosive, because we are about trying to clear up and address equity issues. I mean, we want to do that for our country, because the folks, when they don't get good care, it actually costs us more money. They're being very short-sighted and kind of being penny wise and pound foolish. But I'm not sure that's what this is about.
All right. Well, thank you, Tori, so much for sharing that with us. Let's go to the area of nutrition. Another serious concern here, Carly Robbins from Food for People. And Carly, my team, you know, just with a quick review, was able to flag the Commodity Credit Corporation, Emergency Food Program, Commodity Supplemental Food Program, Local Food Purchase Assistance Cooperative Agreement Program. It's confusing as to, you know, how much of this could affect something like CalFresh and SNAP. They tried to assure us that it wouldn't, but, you know, all of these are also programs that serve communities that have been identified by some of these orders. Tell us about your concerns.
Yeah, and first off, thank you for the opportunity to discuss concerns here, but you named off a lot of them. Our food bank, serving Humboldt County, and many food banks across the nation, rely on federally funded food. For us, it makes up almost more than 40% of the food we distribute annually. So the TFAP, the Emergency Food Assistance Program, which provides most USDA foods that go to food pantries and families, is a huge concern. We've touched a lot on the needs of seniors and the growing needs of seniors, and the Commodity Supplemental Food Program is one of the primary ways that we're able to help that population. So any disruption to those foods would be huge. And just in the last few years, the Local Food Purchase Assistance Program has given us the ability to purchase hundreds of thousands of dollars of food from local producers. So not only is that taking food away from folks who need it, but it's taking funds away from local farmers, food producers who have now ramped up their production to be able to meet our needs. And any hit to that is a hit to our entire community locally. Food for People is already serving more people than we ever have in our history. So this is a huge concern. And you know, from just taking a step back from our immediate concerns, anytime there's a disruption to federal funding, we see an increase in people coming in for food assistance. From government shutdowns on, more people who are furloughed or not receiving their benefits, the more need they're going to have. So that's one of our biggest issues, is we are going to have a convergence of more folks in need of food assistance at the same time as worries that there will be less resources to do so.
Yeah, thank you for explaining that. And of course, you're serving a ton of people that might be undocumented, that certainly are poor, and could trigger the socialism, Marxism political filter that has gone out. So probably a time of great angst for you and your colleagues there doing such important work.
Great fears abound.
Yeah, thank you. And now we have, fire safety, because public safety is very affected by all of this chaos and uncertainty as well. Chief Tom Cipro from Humboldt Bay Fire is with us. And Chief, I know that assistance to firefighters through a federal grant program is something you count on. Tell us a little bit about that and other concerns that you have that might get swept up in this dragnet from Washington.
Yeah, thank you, Congressman, for having me. Specific to the Assistance to Firefighters Grant Program, it's not necessarily something we rely on for funding, but it's definitely something we rely on for replacement of large capital items that are expense that can run into our operating budget. There's also the SAFER grant, which is a staffing for adequate and fire safety. We typically do not use it, but I know a lot of the departments here in Humboldt County. If you weren't aware, there's only 2 career fire departments in Humboldt County. All the rest are small rural volunteer agencies. They use those funds for recruitment and retention of volunteers, which is a problem right now in the fire service. And we're having a problem recruiting and retaining career firefighters right now, to the point where we're having to do rotational station closures. So any type of hit to any type of federal funding that is available to the fire service does affect us directly. And to the point that everybody else has been talking about, whether it's the older adults, the kids, the food services, all those types of things. Those proactive preventative services that are available in the community are something that are necessary for us. And the fact that when those services go away, our call volume increases, because those people have nowhere else to go or ask other than to call 911. And the biggest part of our business is providing EMS services through our EMTs and paramedics. And when we do have an older an older adult living by themselves who don't have the services of the Area 1 Agency on Aging or other services, their only option is to call 911, which then creates a higher call volume for us. They have to go to the emergency room. Now you're flooding the local healthcare system in the emergency rooms. If there's not healthcare in the rural clinics, that again defaults back to 911 to call for help. So all these programs that we've discussed and that I've heard about really make me appreciate everything that's being done out there proactively for our vulnerable populations. And when those vulnerable populations don't get the assistance that they need, that impacts us through call volume and having to increase our services, which are very limited to emergency style services only. And the only thing we can do is get them to the emergency room, where now you're impacting the rest of the community through our local healthcare systems getting overloaded. So it has a huge ripple effect through everything. And we are usually, when those ripples happen, we're usually the first ones to know about it, because we can see those things going on and see these vulnerable populations not getting the assistance they need and relying on straight basic 911 services to fulfill those needs. And yes, we provide a great service and we do everything we can, but we know it's not as good as what's everything I've heard today from everybody. We aren't the solution. We usually are the finder of the problem, and then rely on these other agencies to refer those people to the solutions that are out there.
Yeah.
So If they're not there, it's just going to be repeated over and over and over again. So
It makes a lot of sense,
Mhm.
Chief. Thanks for sharing that. I know that a lot of the fire districts around my district have benefited from the funding we put into the inflation or I guess we called it the Infrastructure Investment and Jobs Act, sometimes known as the Bipartisan Infrastructure
Mhm.
Law, but a lot of fire resiliency money that's been going
Yes.
out to communities for everything from vegetation management to purchasing fire engines to other things. Are you aware of impacts if that suddenly gets clawed back and frozen the way they're proposed?
Yeah, there's, fire safe councils in Southern Humboldt and Humboldt County in general. They've done a lot of proactive work with mostly private property owners and managing their vegetation and their threat to wildfire. I know in Southern Humboldt, they bought some what we call Type 6 engines, which are smaller, allow them to get into these areas and do that. And from a disaster perspective, I don't know if you've heard anything specific about FEMA and holding back disaster funding. But for example, we had an engine in Los Angeles for 10 days. It took 14 hours for us to get there.
Yeah. You'd probably like to be reimbursed for that.
Yeah, it's not necessarily the reimbursable, of course, but it also has to do with the fact that there's a huge system with the California Master Mutual Aid system where all these local government departments support not only CAL FIRE, but also the Forest Service.
Yep.
Controlling these large fires, and they rely on us. And if the reimbursement is threatened or anything like that, excuse me, I'm at work, but it's going to impact our ability to be able to assist the way we have traditionally done. And that's a huge concern. But the proactive things that are going on right now through the local fire safe councils are really helping, and they're really doing a lot. And a lot of the controlled burning that's going on is also producing training for our personnel and all over to be able to become trained in a controlled environment to go to these large scale fires and do the things that they need to do. So yeah, thank you.
Thank you, Chief. I can hear your phone ringing. I hope we didn't interrupt any emergency call.
No, you didn't.
Okay.
Thank you.
But we've got Jill Demers as well from the Humboldt RCD. Obviously, Jill, I'm worried about how, grants for things like post-fire disaster recovery and wildfire resilience could be affected. And then there's all sorts of Farm Bill related technical assistance agreements that I can imagine being triggered because in addition to everything else I've mentioned that falls into one of these executive orders, they've got it out for anything that looks like sustainability, because that is, in their view, part of the Green New Deal. We do a whole bunch of really great critical stuff in the name of sustainability. Tell us, what this could mean to you and your programming in the communities you serve.
Yeah, thank you for having me on, Congressman Huffman. And just to speak to what Chief Citro was mentioning, we hold several wildfire resilience grants through U.S. Forest Service, either post-fire disaster recovery or a grant known as the Community Wildfire Defense Grant, mostly serving Eastern Humboldt and a bit of Trinity County with our partners as well. The greater Willow Creek area up into Wichipec area, that is some of the most at-risk watersheds, also called firesheds at a federal level, one of the top 50, and we see regular fires there every year. So there's about $9.5 million that we hold for post-fire recovery and that wildfire defense grant, which we do work with small rural fire departments on that as well, that we have held work on right now, just given the uncertainty. What's interesting is chatting with the grant program managers, while things legally seem like they should be moving, nobody can really give us assurance that that would be a smart move to move forward.
Yeah.
So, we have work on shaded fuel breaks and other fuels reduction work slated for this fall that we're putting on hold. Several folks on the ground that are also without work.
So work is already stopping.
Yes. Oh, certainly. Yeah, we've been told that it's in our best interest to reduce spending right now while things are looking forward. That could change. It's been so fluid. But sometimes we're subbed off of other nonprofits as well. So as you keep on moving away from, the first recipient, we don't have, and we've told our contractors to stop too, because we're entirely grant funded. So there's no ability for us to really take on additional liability if we can't get reimbursed. We also provide technical assistance through several Farm Bill related grants. While those technically should be safe, and several members of our board of directors have been reaching out saying, "Oh, you should be good, right?" Those are still undergoing DEI review, is our understanding, and so we've been holding off on really spending that time. It's mostly staff time on technical assistance, and that's for kind of environmentally beneficial practices. But these are farmers and ranchers that need to meet their bottom lines as well, so they're not going into the voluntary conservation without making sure that it matches their goals and objectives for their land management, and so it's right now we're just kind of pausing.
Right. And then of course that pause, I think, would, or at least the concern would relate to anything climate related or sustainability related. And I could imagine an awful lot of your grant funding and projects triggering that potentially.
Yes, I mean, just in the Farm Bill alone, climate resilient ag is something that's been focused on. Also in the Farm Bill is addressing underserved landowners. Often those are small rural land or forest landowners. So there's definitions around that in law for all of these programs. So we're targeting outreach and education and then technical assistance and on the ground grants for those folks as well. So I imagine that'll come under review.
Okay. Thank you so much for joining us and sharing that. And we're going to close out with Connie Stewart from the California Center for Rural Policy and also Humboldt Poly. And your Humboldt Poly hat, Connie, I can imagine so many, because you're a minority serving institution. I can imagine so many different ways in which federal funding could really hit the bottom line of the university. But talk to us about your greatest concerns. And I know that broadband infrastructure and service has got to be high among them.
Yes, thank you so much, Congressmember. Right now, currently, we have not received any guidance regarding any of our infrastructure projects in the region. However, I think it's really important for folks to know the diversity word is understandable, but the equity word isn't. And in the state of California, all rural counties are considered in that equity bucket. Veterans are considered in that equity bucket. People who are disabled are considered in that equity bucket. So if we do get word that we have to pull back from these broadband projects, it will be every rural county in the state that will lose their ability to deploy broadband in the region. As I've said, so far we have not heard that, but the state has chosen to put all rural counties in that equity lens. So we're holding our breath. We're also, of course, concerned for our tribal partners who've received broadband grants recently. I recognize, and certainly anyone who lives here recognizes, that tribes are a government and their programs should be protected, government to government relations. But, we're holding our breath. And like I said, so far, so good on those programs. We have over $60 million worth of grants we've received. To date, also at Cal Poly Humboldt, we have not heard that any of those grants have a stop work order. However, some of our partners our partner universities have received notices from, for example, NASA and others to consider stopping programs. Our guidance has been spend less or stop if you can. But, right now we're just still in a hold breath situation. We also, of course, have student financial aid. So far, so good. Far, so good, but lots of confusion and chaos.
Yeah, that's for sure.
Mm-hmm. And well, of course, I would be remiss if I didn't say we're also holding our breath, for our dreamers at the university. And the university did give guidance to all international students to be back before the administration took effect. Because of all our international students in the past have had travel issues going back and forth from their countries.
Well, and more than just dreamers, I am sure that you serve lots of students who are citizens by birthright.
Yeah.
And if this extreme order eliminating birthright citizenship for people whose parents were not documented. I mean, that's just going to have a massive ripple effect as well.
So as I said, we're preparing, we're holding our breath, and we're hoping for better angels to
Yeah.
move forward.
All right. Well, folks, I really thank you so much for sharing these on the ground perspectives and all of this information. It helps me take these examples back to Washington. I'm going to do my best to educate folks about whatever ideology has driven these dozens of extreme executive orders. I don't think this is what people in rural America thought they were signing up for when they voted for President Trump. And the administration needs to really clearly understand that. You're going to help me bring that story back to Washington. And we're not going to stop pushing back on this until we hopefully get it right. So thank you so much. And I'm sure it won't be the last conversation we have about this.